Hi, Tom, Terry, how are you? My name is Grant Sharp. I'm a safety specialist at the Hamilton Health Sciences. Today, I'm here to state that the lighting around the General Hospital and the new build, McMaster Children's Hospital Center, has attributed to many accidents and incidents that we've had over the years. Some specific examples in the past are 4 ice-related falls, resulting in fractured arms and legs. Couldn't see the ice on the walkway. Assaults back on Birge Street behind the General Hospital. They were hiding in the area. And a mugging of one of our nurses with 2 masked men, and that was beside one of our buildings. These types of occurrences have been investigated, and the city lighting improvements would have lessened the chance of these occurrences from happening. Hamilton Health Sciences has committed to our property's lighting with LED type fixtures on Barton, Victoria, Birge, Copeland on the Hamilton Health Sciences property and on Wellington Street. Due to the new hospital, many staff are now walking from our expanded Barton lot, which is across the street on Barton Street. It's my understanding that the city has already committed to LED type lighting in various areas and will continue based on current needs. We ask that these areas around the hospital be elevated on a priority list to help assist HHS in our efforts in creating a safe work environment outside of our buildings for our staff, visitors with their families, and our outpatients. I will hold the ladder. I'm available tomorrow if you would like to start. Any questions?
We do indeed. We have Councillor Ferguson.
Yeah, through you, Mr. Chairman, to Grant. Grant, thanks for coming out today. You're not specific on where exactly you're looking for the lights. You say you're doing the ones around Barton, Victoria, Birge, and Copeland, but you don't say where on HHS property. Where exactly do you want the fixtures and how many? Just so if we refer this for a staff report, that they can better understand what your ask is.
So basically, all the lights on the HHS property will be converted to LED lighting.
You're doing that?
On our property, correct.
Okay, so what are you asking the city to do?
Along Barton, down Wellington, down Birge, up Victoria.
Just on that point, Mr. Davis, we're in the process of just on that point with the LED lighting. What's the schedule for the existing area that's being requested?
Through you, Mr. Chair, we have a report for you later on today, which will see most of what we're looking for as part of that work done in 215.
Councillor Ferguson?
Okay, so we'll be dealing, there's no need through you, Mr. Chairman. There's no need to ask for staff to report back because you're already doing this as part of the LED program.
Through you, Mr. Chair, that's correct.
Okay, through you to Grant. Grant, does that satisfy you? We have a report today, and in fact, it made some media attention this morning also that
I saw that.
Be doing significant enhancements in street lighting, so yours will be included. Does that satisfy you?
So it'll be done in the spring, summer?
Mr. Chairman, to Gary, when do you think around the hospital will be done? Can you move it at the top of the list?
Through you, Mr. Chair, we have 10,000 lights to do this year, and you'll see as part of the report later on. It all has to be done in 215. We'll try our best to look at priority areas.
Put this through you, Mr. Chairman, could you put around the hospital then at the start?
I believe there's 3 different hospital areas that you're looking at, or just the general and
well, Barton in particular, he's saying, and Wellington Street.
Well, we will look at that, take that as direction, as a priority area.
Thank you, Mr. Moore. Thank you, Councillor Ferguson. Councillor Jackson.
Thanks, Mr. Chairman. Nice to meet you, Mr. Grant Sharp. So, Grant, you didn't mention the former Henderson, now Jaravinsky Hospital on the mountain. Mr. Chairman, through you to Grant, all the lighting there is fine?
I didn't mention Jaravinsky.
I know, and I'm asking why.
Why?
Yes, is it the lighting fine there versus the General and McMaster?
It's been brought to our attention that around being a safety specialist, I'm responsible for the property, for all the staff coming there. And it seems that we've had more instances around the general than we have at any other site. So that's why I brought this forward.
Councillor Jackson.
Okay, but you also mentioned in your letter about McMaster Children's Hospital Center as well, many accidents and incidents. So I'm just trying to understand, the Juravinski, former Henderson, all fall under the Hamilton Health Sciences umbrella, but you're just asking us to focus mostly on the general, possibly on McMaster, Mr. Chairman, through you to Grant. I'm just trying to get clear.
No problem. The new build,
Yes?
right, the new hospital, the folks at Shadoke are moving to the new build,
Yes.
which was the old parking lot for, on Wellington, right beside the general. And it's called the Master Children's Hospital Center.
The one site. Thank you
correct.
for clarifying
Yes.
that. Thank you.
No problem.
So the new build up at the Juravinski, the expansion we went through there several years ago, new parking lot across the road expanded. From what you know, that's not one of the priorities or one of the concerns up there. Mr.
Correct.
Chairman, through you to Grant?
Correct.
Correct. And I just want to make sure when we get to report 8.4, Gary, I appreciate Mr. Sharp wanting to accelerate around the general hospital, the LED installation, but I want to make sure that I want to see where all the other priorities are for the city of Hamilton. So before I commit today, I want to hear your report and get into a full discussion at that time. Thanks, Mr. Sharp. Thanks, Mr. Chairman.
Thank you, Councillor Jackson. We have Councillor Duval and then Whitehead. Councillor Duval, the floor is yours.
Thanks, Mr. Chair, and thanks, Mr. Sharp. Through you to staff, maybe to Gary. Gary, because of this, what we had before, Mr. Sharp has brought us about incidents at the general hospital. Obviously, the other hospitals could have the same problems, and I'm wondering if once we pass the LED lighting, if all the hospitals could be done right at the beginning, and then move on from there. Or
Mr.
would
Moore.
that would be a problem?
Through you, Mr. Chair, the initiative that we have before you today is for the high voltage lights. I'm not sure what the voltage of the lights are in front of the other hospitals. We know that the one down at the General is part of this initial 10,000 light upgrade. We have an additional 27,000 lights to convert to LED at some point in the future. We'll be bringing that back to you at other times. If it's part of this, and we'll have a look at that, we can give those areas priority. I believe that some of the stuff that Mr. Sharp was talking today was a combination of their lighting and our lighting, so we're glad to coordinate with that.
Okay, so I take out of that through you, Mr. Chair, if it's the high voltage lighting, and if all the hospitals will give that priority as for the installation, correct?
Through you, Mr. Chair, that's correct.
All right, thank you.
Thank you, Councillor Duval. Councillor Whitehead.
Thank you, Mr. Chair. A couple issues. First of all, does the hospital pay taxes to the City of Hamilton?
Not my department.
I think
Okay.
we know the answer to that. But
Well, I just want to highlight, and I think this is a good example, every time that the hospital comes in and looks for enhanced services around the hospital, we need to understand, Mr. Chair, that the heads and beds that's provided through the institutions hasn't been updated since the early 70s, and certainly isn't even close to what services they're using and utilizing in this community, and therefore the taxpayers of this community are subsidizing those levels of services. I want to highlight that every time the hospital comes in and asks for enhancements around the hospital. And not that I don't support it, but we need to understand that that formula has to be fixed. It's not fair for communities that have 3 or 4 institutions the size that Hamilton does, that we're getting inadequate funding for the services being utilized by those particular facilities. And these are regional facilities that are bringing in over 2.5 million in the context of catchment. So I just want to make sure that that's highlighted. The second issue I have, Mr. Chair, is that we have neighborhoods. We have neighborhoods that have equal issues. I can name some around Mohawk College. So I need to understand what is the criteria to determine the staging of and the prioritization of this lighting system.
Mr. Moore.
Through you, Mr. Chair, I mean, other than taking direction from council, the speed at which this conversion is going to be done for these 10,000 lights, a couple of months before or after is not, hasn't been a priority that we've seen necessary. We're glad to put that forward in our tender to get that work done on that, at that speed, and note some priority areas. As you can see from the report later on, it is necessary for our funding to have it all complete in 2015. So we'll be going at it with whatever contractor with all speed possible. That type of speed for that conversion is fairly aggressive from what normally would be done. I'll just also note that any new construction that we're doing, like the work that we're doing on West 5th and Fennel, the work that we're doing on Concession, the work that we're doing on Mountain Brow Boulevard, those automatically get upgraded to LED. They're not part of a conversion where we wouldn't normally be doing construction. So those types of, that type of work, and as well as King Street in Stony Creek, all get the upgraded LED conversion.
Thank you, Mr. Moore. Councillor Whitehead.
And I appreciate it. I was looking for that clarification. I mean, I understand the issue and it needs to be addressed. I just want to make sure that we're not knee-jerk reacting to these issues and understand there's broader issues. There's people that pay 100% taxes based on current value assessment in neighborhoods that are at risk, and that we need to ensure that if we're going to bring that lighting system, and it sounds like you can do the best you can in 2015, that we take those things under consideration as well, is all I ask. Thank you.
Thank you, Councillor Whitehead. Mr. Sharp, I believe that would be the conclusion of your presentation. May I have a motion to receive? Moved by Councillor Ferguson, seconded by Whitehead. All in favor? Carried. Thank you, sir.
Thank you.